UAPA. Okay. Since inception in 2009, Uganda Alcohol Policy Alliance has actively collaborated with various government institutions and stakeholders, including parliamentarians, the Ministry of Health, Uganda Cancer Institute, the Ministry of Education, and Uganda Alcohol Policy Alliance. We are a network of civil society organizations, and we exist to advocate for alcohol harm prevention through policy regulation. Yes, we have both individual. We are advocating for no harm from alcohol. Sorry? No harm from alcohol. Yeah, yes. As I was saying, that we have been in collaboration with the Ministry of Trade, Industry and Cooperatives, the Ministry of Internal Affairs, Makerere School of Public Health, the Uganda Non-Communicable Disease Alliance, Uganda Youth Development Link, Uganda Health Communications Alliance, and Addiction Prevention Rehabilitation Association of Uganda, among others. Together, we have been working tirelessly, advocating and promoting policies that ensure the enforcement of regulations on alcohol manufacturing, distribution, advertising, and consumption in Uganda. The Uganda Alcohol Policy Alliance, UAPA, respectively submits the following recommendations and observations to the Parliamentary Committee on Finance regarding the Excise Duty Amendment Bill 2025-2026. Our submission is informed by over a decade of evidence-based advocacy and collaboration with health, education, trade, and internal affairs ministries, as well as the national research institutions and civil society partners. We appreciate the Ministry of Finance's commitment to leveraging tax policy as a tool for public health promotion and revenue generation. However, the current Excise Duty Amendment Bill requires stronger, more comprehensive provisions to address Uganda's growing alcohol-related burden. UAPA strongly supports the alcohol tax increment because it is a powerful tool for, one, protecting underage persons by reducing access, preventing health, social, and economic harms through decreased consumption, and promoting national development by increasing productivity and generating the much-needed revenue after the donor cuts and public debt. Why Uganda alcohol tax policy must be reformed. Escalating alcohol policy consumption and related harm is one of those. Uganda ranks among the highest alcohol consuming countries in Africa, with a per capita pure alcohol consumption of 12.1 liters, double the average age of 6.3 liters, and significantly above the global average of 6.18 liters, that is as per WHO 2023. This figure is significantly higher than both the African regional average of 6.3 and also the global one. The report also highlights a gender disparity, with men consuming an average of 19.93 liters annually compared to 4.88 liters for women. Furthermore, a 2024 survey by Ministry of Health revealed that 62.7% of Ugandans engage in alcohol consumption. Of these, 33% consume alcohol daily, while the remainder drinks approximately 3 times a week. Alarmingly, while 37.3% of Ugandans abstain, the remaining drinkers consume excessively, as per Monitor 2024. the consequences are there. We have rising cases of alcohol poisoning and liver-related diseases, increase in gender-based violence, road fatalities, and mental health disorders. We also have injuries arising, assault caused by drunkenness in bars. There is loss of productivity due to alcoholism in working age populations. Number 2, we have weak regulatory and fiscal framework. Uganda lacks a comprehensive legal framework for alcohol control. Unlike Kenya, which enacted the Alcoholic Drinks Control Act 2010, Uganda has no binding national policy regulating production, advertising, or pricing. The absence of regular excise adjustment, combined with inflation and industrial lobbying, renders current alcohol taxes ineffective. We have another one, number 3.3, comparative regional disadvantage. Uganda collects only 13.9% of its revenue from alcohol excise taxes, which is below Rwanda's of 16% and Kenya's over 20% as per UIDEL study 2022. Despite Uganda's high alcohol consumption, its excise rates are lower than the regional peers, and that is indicated in our table here. Uganda excise on beer is 30% or 900 shillings per liter, spirits 60 to 70%, and then 20%. We have Kenya 35% or 120 shillings per liter, and the other percentages. Rwanda has 60%, according to the Ministry of Finance of Alcohol Price and Taxation. We have core issues with the current Excise Duty Amendment Bill 2025. Number 1, OI, unchanged tax percentage rate on beer, that is 30%. Maintaining the 30% tax rate on beer ignores growing public health concerns, undermines the WHO recommended alcohol control strategy, and weakens efforts to curb binge drinking. Number 2, exclusion of high alcohol beverages. The amendment omits stronger beverages, that is rum, gin, whiskey, wine, which contain higher ethanol content, are increasingly accessible to the youth, widen price disparities due to the unbalanced taxation. Number 3, illicit and informal alcohol market. Unregulated local, that is informal brews, remain untaxed. Yet, there is value addition nowadays, attracting a huge market, thus contributing to a public health crisis due to adulterated alcohol, significant tax revenue loss, a reinforcement of dangerous consumption patterns, illegal alcohol thrives due to weak enforcement and lack of coordination between agencies. Number 4, alcohol's impact on food security. Alcohol production diverts vital crops, that is sorghum, cassava, sugarcane, from food chains. Land conversion for the breweries, raw materials, reduce
where are we going? Because
we are about to reach the recommendations.
No, I can see, but for example, on this point, I don't think as a committee we are picking your argument.